Welcome back to Houston Life. You know, we're always on the hunt for the latest beauty trends that promise to help you reverse those pesky signs of aging like wrinkles and fine lines.
And that's where our friends from the Antiage Institute Wellness Center and Medical Spa come in. They have been helping patients like Tessa and me look and feel their best for more than 25 years. Please welcome Dr. Richard Laconi, along with esthetician Natalie Knickerbocker, nurse injector CT Yaya, registered nurse Megan Marco. We also have our lovely models Tracy Thompson, Stacy Casciola. The house is full today.
That's right.
Dr. Laconi, let's talk about this platelet-rich plasma that Natalie will be using on Stacy's face. How does this process work? And Natalie, go ahead and get started.
All right.
Okay, go.
Lean back. So half of her face already done, right?
Yes.
Okay, good.
Yeah, so we did one half just so people can see what it looks like afterwards, and you can see that it's really fairly tolerable. And what it is a little machine that punctures tiny little holes in the skin, micro needling. And so the idea there is when we put on the platelet-rich plasma, which has exosomes and growth factors, repair factors, those micro needling provides little channels for those substances to get down into the skin where they can trigger growth, healing, and just generally rebuilding of the skin.
Wow.
So it's basically a stem cell-like treatment. And what you're providing is, again, channels for the stem cell elements to get down in there and do their thing.
We're hearing a little whirring. That's the skin pen?
That's right.
Explain the skin pen for people who don't know. That's what's going in and making those tiny little holes.
Yes. So it's a sterile disposable cartridge, and it has 14 teeny tiny little needles that are making that micro injury. And we have different depths to choose from. So depending on what we're treating, how aggressive in what area, we adjust the depth.
Okay. And you could be treating everything from texture issues, fine lines, pore size, scarring. And Natalie, before this segment, you actually took Stacy's blood, you spun it out to extract that platelet-rich plasma, or PRP, and that, Dr. Laconi, is now being injected back into Stacy's skin.
Absolutely, yeah. The platelet-rich plasma is a component of the blood that everybody has, okay? And it's actually the component of your blood that arrives at an injury first. So if you injure yourself, then the platelets immediately arrive there and start spewing out all their healing ingredients, okay? Exosomes, growth factors, repair factors that make the skin kick into high gear to repair itself. And that's what this is. We just extract it from the blood with a centrifuge, and off it goes, you know? There it is, the centrifuge.
We're seeing that right now. And Natalie goes, liquid gold. It's liquid gold.
It is liquid gold. And this process is so interesting because Stacy looks so relaxed right now. Stacy, I know you're having a treatment done to your face. Are you feeling anything right now? Are you feeling any discomfort?
Not at all.
Wake up, Steve.
Not at all.
I know she's asleep. You were disturbing her nap.
Sorry.
Kidding.
And then how quickly does the redness go away? I know that's a common question.
Well, you know, you can almost tell, see how red it is here, but it's just barely pink over here. That's the one we did half an hour ago. So,
wow.
Yeah, so the redness fades pretty quickly. You just got to take care of it. By tomorrow, it'll be 80% back to normal, and by the next day, you won't be able to see any sign of it, but just then the healing starts.
That's incredible.
Okay, Natalie Knickerbocker, you're doing a great job on Stacy's face there. Okay, let's find out what CT and Megan are doing. Tracy Thompson, thanks for coming in to model today. It's great to see you. Okay, filler in the hands. This is maybe a new concept for a lot of people, Dr. Laconi. Why would someone put filler in their hand?
Well, you know, I hate to say it, but you know, for folks as they get a little older, the veiny and tendinous hands are kind of I think a lot of people, only the neck is more, you might say.
Like ages the quickest, right?
Yeah, right. And it's something that everybody dislikes. So
we're seeing some before and after photos on our screen right now.
Exactly.
So this is an example where the after, those veins are not as pronounced. We're not seeing.
Precisely, yeah, exactly. Well, you know, the idea here is that, you know, you lose the sub-Q tissue in your hand due to sunlight exposure and aging and other factors. So without that sub-Q tissue to hide all that stuff, it's always been there. It's just that as we get older, we lose that sub-Q fatty tissue that hides it. So we're just going to put this back in here to hide it again.
Okay, so we're watching video of the needle go into the hand right now. Does this, I mean, she's perfectly still. Does this hurt at all?
Very calm, Tracy.
It really does feel like just a tiny pinprick. But once she gets that pinprick in there, you really feel nothing.
Did
We used the
hands?
cannula.
They did. They numbed my hands.
Okay.
for several minutes before. But to Dr. Lacone's point, your hands are such a tell of your age. And I felt like I woke up one day and went, oh my God, I've got old lady hands. And then suddenly when they did this on my left hand today, all of a sudden I see volume.
Will you hold up your left hand so we can see it at home? So this hand was already treated. You have beautiful hands.
Yeah, what a gorgeous hand
But
model you are.
You were self-conscious about that. And this is after treatment. I'm surprised it doesn't look like red.
Lumpy, bumpy, red. No, this was 10 minutes ago.
Yeah.
Okay,
Wow.
that's
The
incredible.
cannula is the key. That little
Explain what the
cannula.
cannula is.
Well, the cannula doesn't have a sharp point on it. We make one little nick just to get through the skin. Then the cannula can go all the way up here. It doesn't have a point or a sharp edge on it. It's just blunt. It just rides right through the subcutaneous tissues. It slides right through there. We deliberately make an effort to avoid sensitive things like the veins. And it's quite comfortable. And yeah.
So we talked about the latest and greatest, but let's talk about Old Faithful. Botox.
The Botox.
You guys are
working on Tracy's neck right now with the Botox. Sorry, I don't know if you can see that, Tessa.
Oh my gosh. Okay, what's going on over there? GT, what's going on?
So we're doing what's called microtox, and she's bothered by these tech neck lines or horizontal lines.
Hey, I'm getting those
So you
too.
can see,
Oh my gosh, I can't even. Okay.
and it's pretty painless, right? I mean, you're getting filler on your hands, and then you're also getting microtox to the neck. And so what that's going to do is help to just tighten the neck area, and that way those horizontal lines are not as visible.
You know, it's so interesting because the neck area, like we were mentioning the hands or a telltale sign of aging, I feel like my neck, we're all kind of looking down at devices and then you have these rings around your neck. And just to be clear too, for anyone who's never done Botox before, it's not filling the creases, it's sort of relaxing that muscle so your own natural collagen can fill in. I feel like I could work at the Antiage Institute. By the way, here's
I'm going to retire and you can take over.
There you go, Derrick. Go to the
Fall
open
Open
house.
House is happening Wednesday, October 16th at 4 p.m. You can RSVP online and you can see this whole gang. Dr. Richard Lacone, CT Natalie, our models Tracy and Stacy, and of course Megan is there, the rest of the team. Brandon's going to be there. Go check it out, everybody.
I'm going to go. Y'all save one of those syringes of microtox for me because right now we have a special offer for Houston Life viewers. You can get $100 off filler and $11 per unit of Botox. That's an amazing deal. All you have to do is schedule your appointment today. How do you do that? Give them a call. They're so friendly and cool over there. 713-807-1000. That's 713-807-1000. Or visit their website, antiageinstitute.com.
It's a good reminder. I need my Botox. They also do semaglutide. The list goes on. Go see them. Thanks, y'all. It's great to see you.
Great. Thanks a
Okay,
lot.
let's take a break. Houston Life will be right back.